Hey, welcome. My name is Rachel Smith, and this is the Natural Health Rising podcast. I am a certified functional diagnostic nutrition practitioner and the owner of Natural Health Rising, which is my online holistic functional medicine company where I help people who have autoimmune diseases, chronic illnesses, mystery symptoms, and a whole host of other imbalances restore their health by natural means. On this podcast, you're going to hear conversations between myself and other health experts on functional medicine and general holistic health. My goal is to provide you with the tools you need in order to help you rise to your healthiest and happiest self. So on this episode of the Natural Health Rising podcast, I have Shae Leonard with me. Shae is a licensed PA and certified functional medicine practitioner. She helps people get to the root cause of their health issues to heal their gut, hormone, and mood imbalances. Welcome to the show, Shae.
Hey, Rachel. Thank you so much. So excited to be here.
Yeah, I'm happy to have you on. So you're a licensed physician's assistant. So I'm curious, can you share the story of what made you leave conventional medicine?
Yeah, for sure. I get that question a lot. So I knew that I wanted to do medicine from a very young age. My aunt's a doctor, and I just was kind of grew up around it. And so I kind of always knew I wanted to do medicine. And I just happened to start having a lot of health issues really early on, really severe health issues around the age of 14. And those went on for about 15 years. And so during that time, I continued to really want to pursue medicine. And I really only knew about conventional medicine. I just really didn't know there was really an alternative option. So going through college, still having all of my health issues, I decided to go to PA school. And I applied to PA school when I was a junior in college. So I figured out pretty early that that's kind of what I wanted to do. And I graduated undergrad and started PA school the next week. And so went through PA school, loved it. It was amazing. I did my training in Texas Tech in Texas. And it was a good experience, other than I was a hot mess the whole time. Horrible health issues. I had seen probably 10 to 15 specialists over that, 10 to 15 years all over the country, and didn't realize so much that I had really been failed by conventional medicine, even while I was pursuing it. And so I became a PA, and I worked in allergy and immunology, and then I worked in psychiatry. And during that whole time, again, I was still feeling horrible. Felt like I cried multiple times at the end of seeing patients, because I cannot even help myself. I can't even hardly get through the day. And how am I supposed to help anybody else? And I finally met my first functional medicine person ever. And she's a functional medicine pharmacist. She's one of my really good friends. And for the first time ever, in our first meeting, I felt heard for the first time. And I had seen countless specialists. And she gave me hope and listened to me for the very first time. And within 2 weeks, I felt like a completely different person. We did a nutrition plan. We worked on some mindset. She put me on some stuff to help with my hormones. And literally in 2 weeks, my brain fog was gone. My inflammation was down. My anxiety symptoms improved tremendously. And that was just the beginning of my journey. It was a long and tedious health journey because of some of my symptoms and the complexity of them. But I knew right then that this was life-changing for me. So I really started just digging into it and learning on my own, reading books and stuff like that while I was still practicing in conventional psychiatry. And I started trying to do some of it with my patients at the time. And most of them were pretty resistant. They're like, why are you all of a sudden asking me about how many times I go to the bathroom every day? Why are you asking me about my water? Why are you asking me about nutrition? And I started to get a lot of resistance, and I just felt like it wasn't my place anymore. I felt like there was a need, but I just wanted to go all in. So I went back to functional medicine school for a couple years while I was still practicing as a PA. And it was the best education I've ever received in my life. It was like reading the books and the stuff, it was just like the most fun and exciting thing ever. I became so passionate about it because it changed my life. And so, yeah, basically I quit my job in conventional medicine and I have not looked back. I started Shae Leonard Wellness Health Consulting. And people ask me all that all the time. Well, don't you miss prescribing or don't you miss? And I'm like, no, absolutely not. I help people more now than I could have ever imagined that was even possible. And it changed my life. There's just nothing I regret about that at all. Definitely best decision I ever made. And so thankful for that education. You know, of course, it's helpful to have knowledge, but yeah, best decision ever. So that's where I'm at now.
That's amazing. And good for you for like trying to implement that stuff when you were still in the conventional realm. What were you, I'm sure you were seeing a lot of people with like anxiety, depression, and of course, other mood imbalances. What at the time was required of you? Like, what were the conventional treatments and what's wrong with that in your eyes? Like what could be harmful or what's a different way we could look at this?
Yeah. So, you know, the hardest part was it really is, you know, I think I never blamed anybody else. It was just the system. It was what people were used to. They came to me for a pill. They did not come to me for lifestyle changes. And so it was just the whole mindset, you know, you're having to try to undo ingrained beliefs about the medical system in a 30-minute visit. I was still very limited of how much I could spend with them, how much they wanted to spend time with me, and how often I could see them. So there was really no support or educational aspect of it. It was just still a 30-minute session trying to, you know, change everything they'd done for 20 years. It just wasn't an effective model, number one. And then, you know, the prescription medications, you know, obviously I was really good. We did pharmacogenomic testing and we, you know, had most of our patients on magnesium, and we tried, you know, as I was in an integrative psychiatric office and I felt like we definitely did better than, you know, a lot, but I just didn't see relief, was the problem. You know, it was like, we've been on this for 10 years and we've really had no improvement, or I've tried all 5 of these different things and we've seen no improvement. And when I started asking questions, nearly all of them had horrible periods. Nearly all of them had bloating or constipation. Nearly all of them had some sort of inflammatory or dynamic. Nearly all of them had mindset and thinking patterns that needed corrected. All of them were stressed. It just was like very obvious that that pill was not addressing any of those things. And we know that. So understanding and realizing that, you know, SSRIs, for instance, you know, they degrade the gut lining and they cause problems like that. All of them, a lot of my clients, because I did child and adolescent psychiatry as well, they were on birth control pills and dealing with newfound anxiety and gut issues after being on them for a year, and no one making that connection for them, that synthetic progestin, you know, is linked to anxiety. And we see that commonly. That was just never talked about or addressed. And I was not taught those things in training or in conventional medicine or any of my time in psychiatry. So once I started learning those things, I saw the big gaps in what we could actually do to heal and address the root cause.
Mm-hmm. Okay, so you brought up root cause. So what are some of the most common root causes of things like anxiety and depression?
Yeah, these mood components, even to the extreme of like things like schizophrenia, and then ADHD, we know that there's underlying gut and brain inflammation there. Primarily, we're seeing brain inflammation, whether that started from the gut or traumatic brain injury or kind of autoimmune dynamics. Whatever the case may be, we're seeing that neuroinflammation is really at the root of most of these mental health concerns. And it's kind of a term called leaky brain. Now, most people have heard of leaky gut, and they work very similar. So interesting enough, of course, leaky gut and leaky brain go hand in hand, and most people have both. So we know that leaky gut, that enhanced intestinal permeability, can cause a lot of immune issues. We get a lot of inflammatory pathogens and endotoxins and lipopolysaccharides entering into our bloodstream when they really should have been staying in the gut. Well, they do that, and they unfortunately also start being exposed to our blood-brain barrier. And our blood-brain barrier also is selectively permeable, and so we can actually start getting degradation there. We can get something called microglial cell activation, which is just basically a whole host of inflammation in the brain. It slows down neurotransmitter responses. We get brain fog as the primary symptom of brain inflammation, and then closely following depression, anxiety, mood concerns, and things like that. The gut's directly connected to the brain, so we also tend to see a lot of dysbiosis or overgrowth or leaky gut, food sensitivities, also connecting directly to that brain inflammation and those symptoms as well. And then last, hormonal nutrient deficiencies and some issues with genetics can all play a role. Genetics is really interesting to me. I still do genetic testing on all of my clients, and I've been doing genetics for probably 10 years. When I worked in psychiatry, now I just see it completely differently. I use it as epigenetics for my clients and really give them hope of understanding these pathways like methylation, and most people have heard of MTHFR genes, and we know those are linked to mood and energy, and supporting them really makes all of the difference. There's genes like COMT, catecholmethyltransferase, it breaks down adrenaline. Some people are sluggish at doing that, and that is a very different dynamic to approach than someone who's normal there and they just have inflammation dynamics. So it's really the full picture for me of addressing all of those things. And then of course, nutritional deficiencies like B6 deficiency and whatever else, but also not accepting, oh, we have a B6 deficiency. It's why do we have a B6 deficiency? Why are we so low in there? How do we correct that? We know that that's the precursor to serotonin and melatonin, and it's all just 100% interconnected. So a long story short, there's multiple root causes, but in a nutshell, it's gut and brain inflammation.
Okay. So neuroinflammation, brain inflammation. Oh my gosh. I had that so bad when I was younger, like my whole life and all the way until I discovered my autoimmune disease. I mean, I used to have severe panic attacks, severe depression, severe anxiety, ADHD, all the things. And I remember when I also was like studying on my own, trying to figure this stuff out. And I remember reading this book called A Mind of Your Own by Dr. Kelly Brogan. I don't know if you've read that book before, but she was a traditionally trained psychiatrist, I believe, who went, holistic and functional. And that was the first time I read how food and sunlight and all of these things impacted your mood. And I just devoured that book and started changing things. And it was just eye-opening to finally see like, oh, wow, I have control over my brain fog, my depression, my panic attacks, like all of these things.
Yeah.
So, it's amazing that we can do that, but can you share some more ways, like what does someone do to actually fix leaky brain and all of this stuff going on with the neuroinflammation?
Yeah, so true. And those were my symptoms too. Just severe panic attacks. I was having seizures, just so much brain inflammation. Brain fog was utterly debilitating. I don't even know how I saw patients. I mean, I was so dissociated, like just not even present, so out of it all the time. And so, yeah, it's definitely my passion. I have a lot of clients with severe brain fog, with severe autoimmune things like MS and things like that I work with and see, because I am so passionate about those, because I've experienced some of those brain symptoms, and they're debilitating for sure. So really addressing overall inflammation is number one. Getting sunlight, getting walking, getting outside in nature, supporting your gut health, eating nutritious whole foods, avoiding inflammatory processed foods. That alone, I mean, when I first got relief, all I did was change my diet. And I had significant improvement within weeks. So that alone for me was a game changer. I do that with my clients. I do an anti-inflammatory reset for 6 weeks. And I mean, I have clients experience full symptom resolution within that time. And really all we did was lifestyle and nutrition. So that is huge, addressing that. Now there might be some overgrowth or over nutritional deficiencies that need extra tweaking and support to take you to that next level. But oftentimes avoiding processed inflammatory foods, consuming plenty of water, working on stress reduction, breathing from your belly, getting outside and walking in nature, those type of basics are a game changer for not just inflammation in the body, but specifically brain inflammation. Neuroinflammation specifically, there's kind of like 3 different areas, like basically mild, moderate, or severe, and that definitely changes things. If severe would be cognitive decline, seizures, history of traumatic brain injury. There's a lot of support we have to do with them. Anti-inflammatory herbs is really helpful, definitely nutritional changes, and then addressing kind of as a checklist all of those physical stressors that are causing inflammation, like mold or bacterial overgrowth or toxic overload. We kind of just go through one at a time to kind of really decrease that burden and allow the brain to heal. Now, depending on the severity, there is a healing versus remission that does occur. And our goal really is remission in those type of instances where there is tremendous symptomatic relief, but we have to be very on top of that and really maintain that. As someone with history of autoimmune, you can relate, I'm sure, of kind of what that goal looks like for them. Mild, you might have a lot of symptoms, but we can typically get that under control very quickly with anti-inflammatory lifestyle and nutrition changes.
Okay. So can you go a little bit deeper in explaining like some of the most inflammatory foods or even things that might trigger like anxiety or depression?
Yeah, so we actually know, and I know no one wants to hear this, but we know that gluten is directly connected. If you even if you don't have celiac, of course we do stool testing to check for things like anti-gliadin antibodies and so on and so forth, which is helpful. But just in general, as a rule of thumb, if you're struggling with mood symptoms at all, it is beyond worth avoiding gluten 100% for several months. Now, when we tend to see gluten and mood being related, gluten and the proteins zonulin, they degrade the gut lining, and that's where we see this, okay, now we got leaky gut, now we got inflammation, now we got leaky brain. So that's where we're seeing that kind of dynamic. Again, the gut's directly connected to the brain as well. And so food sensitivities absolutely can cause brain fog, anxiety, and depression. But gluten is one of the most notorious for doing that. And most people don't have gut related symptoms. It's just, a day or two later, it's fatigue, brain fog, anxiety, headaches, rashes, and things like that. So it can be tricky. Also, once you're exposed and you do have that, if you have a gluten intolerance, it unfortunately takes months to reduce that inflammation. So it really is like a big 100% avoidance trial. I've had that be all that they did and make a huge change, like didn't even change the rest of their diet. They just avoided gluten and you can see huge improvements. So that would be a big one. Next would be just processed foods in general, really getting away from consuming processed and packaged foods and sugar, refined flours and carbs. I tend to see that being a big problem, as well as like artificial sweeteners and colored foods like red dye and those type of things. Blood sugar stability, blood sugar regulation is also a very, very key component for not just inflammation in the body, but just mood. We see most clients struggling with mood are also dealing with blood sugar instability as well. So avoiding those refined flours and sugars and eating more protein and healthy fats and veggies is so helpful. So focusing on whole foods is really key, and making those swaps as much as you can, one swap at a time, to really get more high quality protein, healthy fats, plenty of non-starchy veggies, and also starchy carbs like sweet potato and carrots, and all of those things are beautiful, but really minimizing inflammatory oils like sunflower and canola and corn, and pretty much eliminating those as much as you can from your diet 100%, and then avoiding gluten. For my clients with hardcore brain inflammation, we also avoid grains for an extended period of time. Also with my autoimmune clients, unfortunately, the cross-reactivity, and it just doesn't tend to be a very good option for them. And so in those instances, avoidance of dairy and grains is really, really healing and helpful. And I know, sorry about the dairy, some people can do well with it, but, you know, in an acute healing phase, depending on brain inflammation and autoimmune history, again, our body also sees dairy as a cross-reactive to gluten. And so sometimes that needs to be eliminated as well.
Yeah, really great explanation. And I just always remind people who hear all that, like, oh my gosh, what am I supposed to eat? Right. That's what they all say. It freaks them out. I was freaked out when I did it for the first time too. But if you kind of zoom out a little bit and think like, okay, if I just dedicate 3 months, or maybe in more extreme cases, like 6 months to this nutrition plan, that is a really, really small sliver of the pie of my life to feel like maybe 100% better. So it's totally worth doing it. It might be hard in the beginning because we have to like get away from these addictive tendencies to dairy and sugar and gluten, because they create that addictive response in some of us. But like once you break it past that, man, it can really just totally change your life.
Yeah, I love that. And I love that you bring that up because it's so true. And obviously we work with clients with a lot of support and accountability. We're talking to them all the time. So we're able to work through that. But if you're just someone listening, it's like, holy smokes, you know, how am I going to do that? But I love how you explain that. It's like, yeah, but what I tend to see, and especially from clients, they're like, oh my gosh, within 3 to 6 months, I reversed 10 years of damage. And it's like,
Yes.
whoa, okay, that is the big picture. And then not just that, I've prevented where we know our health was headed. We've prevented and we've corrected our health trajectory in as little as 3 to 6 months, which is mind-boggling that we can actually reduce that amount of damage that quickly. If anything should be shocking, that should be shocking. It's pretty miraculous what our bodies are capable of.
It definitely is. You also mentioned gut health, kind of in just like a very general term.
Yeah.
What do you mean by that? What does that look like for someone to work on their gut health?
Yeah, so very important. I love speaking on the gut because it's so important for our overall health in every single instance of everything we've just talked about today. And I would say the biggest things is to support your gut. We need to eat diversity of foods and focus on whole foods. And that's going to be really, really key. Now, unfortunately, with the gut health, it is a lot of avoiding things. It's a lot of avoidance of things that don't wreck your gut. Like, you know, chronically taking antibiotics often, or birth control pills, unfortunately, degrade the gut lining. As I mentioned, specific antidepressants like SSRIs degrade the gut lining. So those are all medications that are problems. All NSAIDs, including ibuprofen, but also Tylenol is not great on the gut either. And then antacids. So there's a lot of medications that many people are consuming regularly that are doing a lot of damage to the gut, especially when you've been doing that for 10 years. We can basically poke holes in our gut lining, leading to leaky gut. And then we can also cause dysbiosis in there. Also stress, which no one wants to hear, but, you know, stress is one of the biggest impactors on our gut. And making sure that when we live in this go, go, go lifestyle, and I was that person, I lived in fight or flight for probably 10 years or longer. My digestive capacity was low, my stomach acid was low, I had bad guys overgrowing in the gut, and stress was a huge contributor to that. And so just having good eating hygiene and relaxing when you're eating and chewing till nearly liquid and setting your fork down in between bites, like that alone helps support your gut and your digestion, doing that over time. And then, as mentioned, nutrition. If we eat a lot of high carb, high sugary foods, we tend to can get things like dysbiosis in our gut. Or if we're grazing all day on high sugary carb foods, Basically, it can create an overgrowth of bad guys, or the bad guys just move where they're not supposed to be. And that can cause severe bloating and severe dysbiosis and symptoms that it's a problem. So nutrition also plays a big role. And then avoiding things that really just get rid of our healthy microbiome. We want to build up our gut bugs and build up our microbiome. There's trillions of them. We are the vessel. If anything, they are in charge. And we're afraid of them. We use sanitizer and disinfectants way too much. We really need to be cautious and avoid those type of things. Basically, also drinking it in the form of alcohol, that is also a problem for our gut bugs, big time. And also toxins in our environment, pesticides on our food, really going to decrease and avoid them as much as possible. I always tell my clients, we got to just boost the good stuff and reduce the bad stuff, what's harmful for us. We cannot be perfect. I am not perfect. We just need to make sure day to day we're boosting the things that help support our gut, like whole foods and fermented foods and going to the restroom every single day, and then reduce all of the things that cause degradation of the gut lining or suppress our microbiome. And then just create sustainable lifestyle choices to really maintain that long term.
Yeah, it's a lot. We would need a few hours of a podcast to go over all that.
For sure. It is a lot.
Yeah. So you talked a little bit about like birth control pills, antibiotics, SSRIs, Tylenol, all these things that put pressure on our system and our liver and our gut and all of that. So maybe you can give me an example, maybe not. But if I came to you as a client and I was like on birth control and SSRIs, what does that look like for me? Like, can I get off of those within a month, within 2 months? Can I get off of those? Explain that process a little bit.
Yeah, I mean, I feel like that's a common dynamic. I would say probably majority of my clients come to me on some sort of mood medication as well as birth control, because I talk about it so often. And it's very important. Now, I care a lot about the type, being on something like Cymbalta or Effexor is very different than being on something like Prozac. And that just is my experience because I worked in conventional medicine and I wrote those drugs all the time. I'm just so familiar with their pharmacology. Those medications, have to be closely tapered and can cause a lot of withdrawal symptoms. And so that is a very different dynamic. Now, I have had many clients be able to get off Prozac and Lexapro within a month, 2 months of working together, get off birth control within 1 month, 2 months, 3 months of working together. But really, the good news is we address it the same. We really just can build up and address the insufficiencies, heal the gut, work on stress and mindset, work on things like brain inflammation. And even though they're on those medications, they get relief. And that's what they want. They get relief. And then we advocate for them to speak with their psychiatrist or their prescriber, and start having those conversations. And they know it's very intuitive. I feel really well every day. I'm no longer having these symptoms. I feel ready to have this conversation with my doctor. Amazing. And then they have that conversation with their doctor. Their doctors want them to feel better. I've never had a problem ever with someone going in and say, I feel amazing. These are all the things I've done and changed. My lifestyle and nutrition are completely different. I feel well. I'd like to talk about tapering. I've never had a client report back that they had any issue doing that because they're in a good place. And no matter if that doctor is as familiar with these type of dynamics or not, they want them to feel better and they're happy that they got relief. And then they're able to have that conversation with their doctor. But yes, 9 out of 10 times, clients are able to get off of both of those things in as little as 3 to 6 months. Again, if you're on high doses of things that are very difficult to taper off, it's just a little bit more of a longer process. Doesn't mean it's not possible. It's just a way longer process. It might be more of like a 12-month type situation. And you work very, very closely with your doctor to taper and do so.
Mm-hmm. What do you say to someone who feels like very attached to the medication?
So We do a lot of mindset work. We do a lot. We spend 6 weeks at the beginning of working with clients to undo years and years and years of ingrained beliefs or thinking patterns associated with medication specifically. And then also just, whether there's been trauma or whatever the case may be, working through those patterns is really important. Once you get relief, it's a lot easier for people, for sure. Like they feel good. So it's like, okay, like I don't feel like, I feel good about doing this. And really just a lot of education about it. We've known this for years, even working in conventional medicine. If they worked, then, I wouldn't have been busy in psych. I was swamped in psych because it wasn't working. So really, we have research articles, even recently molecular psychiatry came out with a really good study showing that we're not even sure that, depression's even linked to SSRIs at all or relieved with them. And no one should be surprised by that because since the creation of them, we've only seen increased rates of depression and anxiety, not decreased rates. So that makes total sense. It's very easy to step back and say that most likely these are not the answer. Most likely these are not working. We were just told that this is the option. And so we believed that that was the only option. So really it's a lot of mindset and undoing that type of belief. Some people like to look at research articles and I'm happy to share that with them and say, hey, this research shows that it really does not help those symptoms. We know it's brain inflammation and gut stuff, and that's what we're going to address. So I would say a lot of education and support for sure, and then rewiring those thinking patterns because we hear something, especially from an expert in the field, and it doesn't mean that that person doesn't have good intention. I can speak from personal experience. I loved my patients and I had great intention. That doesn't mean I was practicing the best medicine that I ever could. And it was because I wasn't taught that. So do I blame that person? Sometimes it's just not a good person, but oftentimes it's just that they had amazing intention. They just were not taught these type of things in school. I was not taught those type of things back then. And so it's just kind of educating the client that, hey, like, they're amazing. They love you. They want you to feel better. That was just all that they were taught. And so that's what they were telling you, and just kind of helping them advocate for themselves.
Mm-hmm. Are there things that, I don't know, maybe this is a yes or no for you, but are there things that people can do on a daily basis in their life that help them rewire their mindset? Or like, what does that actually look like?
Yeah. So the biggest thing to start doing that for me is to be aware of our thinking patterns and our thoughts. So often we just let them go chaotically through our head and we think of something and then it's the rabbit hole of all of that stuff. Now, if your brain is literally on fire, like there's only so much talk therapy you can do. Like, listen, if your brain is on fire, it is very difficult to rewire your thinking patterns. It is very challenging, as you could relate. Like if you have brain fog all day and you're just kind of like, please snap out of it. Like, don't think that way. It's like, okay, there's physical stuff that needs to be addressed.
Yes.
So that's really key. But as far as doing that, be aware. And always ask yourself, like, was this a helpful thought? Was this not a helpful thought? And we move through this very quickly. And then you forgive yourself immediately. Forgive yourself for that thought. Our thoughts are not facts. I think that's the biggest misconception that we should have all been taught when we were in kindergarten. Our thoughts are not facts. They are typically conditioned beliefs and patterns that we have seen and been taught. We're taught fear. We're taught fear of these things. So thoughts are not facts. So be aware of it, forgive yourself and say, what's the next best thought? I don't need to go from 0 to 100. Like, we just need to say, what's the next best thought here would be, hey, today is a rough day, but I know I made progress yesterday. It's going to be okay. I'm going to just give myself today, and tomorrow's a new day. Okay. You don't have to be like, hey, you're the most happiest person in the whole wide world if you're not feeling like that. That's not helpful. Our subconscious is brilliant. It's trying to protect us, and it oftentimes is, it's just brilliant at what it does. So it's really just what's the next best thought. So I would say be aware. Don't be afraid of the thoughts. They're not facts. They're not facts. How do they make you feel? Do a quick little rewire of, instead of like, I am now taking steps back because I woke up today. I'm taking all my steps back. I've made no progress. Instead, say, look at all the progress I've made. That's it. Like that is it. That's one. You might have 10 minutes later, another one, and you do the same thing. When you're starting off, it might be 100 freaking times a day, and it's exhausting. I know it's exhausting, but it will become automatic where you're able to subconsciously just move past those negative thoughts very, very quickly, and you get quicker and quicker at it. But it is a skill and it takes practice. Also, visualizing. Every day, visualizing your health, having gratitude, picturing your health as if it's happening right now, and you're so grateful for it. I always tell people, like, let yourself smile and cry and sit in that emotion of what that feels like and what that looks like for you. And some people, it just literally might be like this white room and you're just smiling and happy, and that's it. And it's just like, I want that. I am that. Really start accepting that as who you are. And start breaking that cycle of hanging out in the, am I a victim here or am I a victor? Just kind of moving from one mentality to the other, even in the midst. Okay, that's always the difficult part, but even in the midst of healing, or what I tell people is called the pit of despair, there's only 3 options. You act, learn, and adjust from that situation and that circumstance. So visualization daily of your health, affirming your health instead of your symptoms. We have all been conditioned, especially when we go to the doctor, to say, this is my diagnosis, these are my symptoms, and I have it for life. Breaking that pattern is key. I always tell people in the middle of our stuff, in a very gracious and loving way, is they start telling the story and they're like, well, my anxiety. And I'm like, nope, like we're stopping it right there. We're not affirming that. We're saying this anxiety symptom I felt. Okay, I want to break that association with their identity of my anxiety, my depression. We start breaking that, how we're even associating it. I had an anxiety symptom because I drank caffeine and I shouldn't have. Okay, amazing. Like, we're going to start addressing that. Or even adrenaline. I felt adrenaline when I had this situation happen. So we're breaking that affirmation of constantly affirming symptoms and illness, and even following social media accounts that constantly affirm illness and symptoms, breaking that habit by affirming wellness and healing. That is one of the most helpful things that we can do. And I've even had clients report back to me and say, like, I didn't realize how many of those type of accounts I was following, and I thought they were helpful, but now I'm looking at them and I'm like, oh, like, this is not helpful. That's just keeping me in that cycle. It's meant for support, but it's really preventing my healing by me constantly affirming that I have that symptom every day. That functional medicine doctor that saw me for the first time, at our first visit, she looked at me and she said, you will never be free of anxiety. Yeah. And she paused, and I paused, and I was like, oh my gosh. And she said, until you stop telling yourself every single day that you have it. And I'm like, whoosh, right? We have to break that pattern. And for me, who identified as that my whole life, because I had actual symptoms, it's not like I was making them up, but I had to break that pattern in order for my healing to take place.
Oh my gosh, you just said so many good gold nuggets in there. I love all the mindset stuff. Cause it really helped me in my journey too. I remember, like, I got my diagnosis and I felt like I was doing all the things, like I changed my diet and this and that, but I kept telling myself, oh, well, I can't work out the same anymore because I have an autoimmune disease now. Oh, I can't go out with my friends now because and I need to sleep. And I was stuck until I started reading books about mindset, Joe Dispenza and spiritual books and things that talked about this and affirmations. And just one day I was over it. I said, you know what? I'm going to do this. I'm going to do the affirmations. I'm going to break my negative thoughts. I'm going to start gratitude journaling. And man, that just totally changed my level and my ability to actually heal. Yeah. And I love what you said. It was, our thoughts are not facts. That is like pure gold right there, because they're not. Like, from age, I think it's till age 7, a lot of our belief patterns are conditioned into our brains. And so we think things that we were taught so long ago. And so once you become aware of those things and you notice them, that's when you can really start to change that pattern. Like you're saying. So yeah, I love that so much. And for the accounts, are you talking about the people on Instagram who kind of like they have a disease maybe and they talk about it all the time and they're like empowering themselves that they have this, like those accounts?
Yes.
Yeah. Okay. I'm familiar with some of those.
Yeah, it's tough because you don't realize that that's something, you know, and it, not even saying they don't have bad intention. It's meant for support. But what we have to understand about our brain is that our body follows our mind. And so if it follows our mind and we are constantly affirming that and saying, well, all these other people have it too, and they're having all these symptoms, and it gives us a little bit of a sense of relief because other people are going through that. And that's okay potentially in a short term, but we just have to understand long term, constantly staying in that prevents our healing. That's just is what it is. It absolutely prevents our healing.
Absolutely. Absolutely. What do you think about the placebo effect, and does this have an impact on healing?
Yeah, so I actually have a whole section in my workbook in my course for my clients. It's called The Power of Placebo. So yes, again, just like I mentioned, our body follows our mind. The Spontaneous Remission Project has thousands and thousands of scholarly articles and research just showing this in a conventional setting. We know that the power of placebo is real. We also know what most people don't use this term is nocebo is real. And so really placebo response is basically being told that something would help them and you believe that it will help you, and so it helps you. But what's interesting enough is a true placebo response requires a physical response. It has to be physically measured in a scientific research type dynamic. You have to be able to physically measure that response. And people are like, whoa, so it's not just mind. Like, no, it is a physical response that occurs because you thought that it was true. That is actually a measured placebo. So a good example, there was a research article done of people who had, like a broken bone. I think it was a broken arm. And one group, they confirmed it on x-ray. Okay, so we know there's a physical problem. One group underwent hypnosis, the other group did not. Very obviously, blatantly, the group who went under hypnosis had faster healing of the bone, faster recovery, and faster mobility. That is a placebo response. Okay, that is a physical thing we were able to measure based on visualizing and thinking that it was improving. Okay, so that's the perfect example of kind of that. So visualizing your health, affirming your health, taking something and thinking in your head and knowing that it's going to heal you inevitably does. Not all of the time, but very high percentage of time. I think for most people, what's more interesting or scary is the nocebo effect, which is these conditioned thoughts. There was a study done on people who they had cancer, they were undergoing chemotherapy, and one group was put into a placebo where they were given saline and they lost their hair. Okay, so that is so culturally and conditioned. We know that that is a side effect of chemotherapy, so much so that these individuals lost their hair after getting saline. Okay, so we can have our thoughts. We know exactly how to use our thoughts to our detriment. The vast majority of us do that all the time. I know I did. My thoughts were my detriment, but it works the opposite way. We can use our thoughts to our betterment. Now, I wish it was 100% of the time. It's not. It's different even on all across the studies. It'll be like 50% of improvement in colitis, even confirmed on colonoscopy after taking a sugar pill. Like, we see that. We know that that's possible. So we have to use the power of placebo to our benefit. I even tell my clients to look at their supplements and be like, these are healing and nourishing me before they take them. Like, yes. Really believe that, like really hold on to that, visualize them literally going in your body and like doing magic. That is how important this is. But we want to be aware of the things we say and the thoughts that we have. And I can't remember the person, but never affirm or repeat about your health what you do not wish to be true. I believe that wholeheartedly. So really being aware of how important the words that we say to ourselves and the things that we think about and how much that impacts our physical health. That is placebo It is a physical measured response from thought alone.
Mm-hmm. Yep. Oh man, it's so powerful. It's crazy. Um, Kind of a non-human related example. You know about the plant experiments that people do all the time where they take like one group of plants and another group of plants and they say very nice things to the plants like you're beautiful, I love you, you're amazing. And then the other plants they're like I hate you, you're ugly, you're stupid. And literally words have frequencies to them. And so these plants that are talked to kindly is what we would think of as kind and loving, grow and flourish. And then the other group of plants die. And it's like, oh my goodness, this is so crazy, but it's real. And that experiment's repeated across the board in schools and all over the place. So yeah, there's so many examples out there of this stuff. But I love that you talk about that with your clients. I do the same thing because it's just so powerful. Like our mind is an amazing thing that we underutilize sometimes or use improperly sometimes for our health.
100%. I think that you hit the nail on the head. And yeah, that's such a cool experiment. And that, yeah, like you said, there's countless, like I said, those two I mentioned, there's thousands of those done on placebo surgeries and all sorts of stuff, like people having full remission after a placebo surgery. Like it's incredible. So it just goes to show how impactful our brain is and our mind, and making sure that we honor that. And I always tell people, what stories do you tell yourself every day? Because we have to rewrite that narrative, because that replay it can cause physical damage.
Absolutely. Okay. Well, I think we should wrap up. This was an amazing conversation, but I do have one more question, which is if you could leave the listeners with one tip that they could implement maybe even today or this week that can help them live a healthier, happier life, what would that be?
I think we just have to say, start affirming health. I would say write down 10 affirmations of your health. I think one of my biggest ones was, I am not fearful of my health. That was one of the most life-changing affirmations I ever did, because I lived in fear for so much of my life. And closing your eyes and visualizing yourself happy and glowing and running or lifting or just outside in nature and saying, I am no longer fearful of my health. I mean, that to this day, because I literally ingrained that, makes me cry and get goosebumps, because I have associated that emotion with that affirmation. And that's really important, to have the affirmation and connect a positive emotion and then have gratitude that it's already happened. It really needs to occur in that way. So I would say create 10 affirmations about your health or your life and start visualizing them every day and really sit in that emotion. Feel what it feels like. Allow yourself to smile and tear up and really sit in that emotion, and then be grateful that that's who you are.
I love that so much. Well, thank you so much for being on the show. Do you want to share where people can find you to work with you or just learn more information about what you do?
Thank you so much, Rachel. Sorry, my dog's barking in the background. Shae Leonard, and my website is www.shaeleonard.com. I'm really active on Instagram. It's at Shae Leonard, as well as TikTok. And you can use my link in my bio or on my website to book a call with us and learn more.
Awesome. We'll put all the links in the show notes. And yeah, Shae has an amazing Instagram. I love it. One of my favorite health accounts for sure. So definitely go follow her on there. And thanks again for being on the show.
Thank you so much. Take care, Rachel.
Thanks for watching the episode. I really hope you enjoyed it. And if you did, make sure that you like the video and leave a comment and share it with a friend who really needs to hear it. Because when you share this information, you're also going to help other people level up their health. And if you or somebody else you know wants to work on their health and they're looking for a functional medicine practitioner, feel free to reach out to me to apply to work together. Thanks for watching, and keep striving to become your healthiest, happiest self.